The reason why you bring people together to have the discussions together is because there is actually a dialogue going on there. Then you can get into the nuances of what are appropriate solutions. Sometimes when people are asked things through a questionnaire, they can only answer the questions that they're asked. And when we're having a discussion with people, we can actually get to the heart of what do you mean by that? And what are the things that are really going to make a difference to that?
It was a good way of starting off, I think, because I wouldn't have thought of sort of putting down in writing all my problems I had and everything. But this sort of process helped a lot.
The meeting with patients firstly drew on the films from the archive. That started actually all of the discussions and played the pivotal role in the study. We also managed to do part of the afternoon around emotional mapping, and so patients talked about their whole clinical pathway from GP referral to treatment. And again, that also raised touch points across the cancer pathway for lung patients.
You can see patients gaining support and almost growing in stature at the event. They come in and they're quite nervous about how the process is going to pan out, if you like. But actually, once they see the film, all the events, they were really pleased with the film, but it also gave them a connection to each other, and it helped them to start talking to each other about their experience.
So the emotional mapping exercise gave you a series of points across a cancer patient's pathway. So initially from GP, from your initial symptoms, across to the points of meeting secondary care, primary care, and then tertiary care and treatment. And within that whole pathway, we talked to patients about how they felt across each individual stage, and did they come across any complications within those particular points. And I suppose that's how we used it, and we then looked at those individual points where people felt there was a heightened degree of anxiety or stress, or a heightened degree of lack of support, and then we discussed about how would we change and improve that.
Because it was a very small group in a nice setting, everyone got a chance to give their own views, speak. You weren't felt as though you were just there for the just to make the numbers up. I think everyone enjoyed it because they knew that they were hoping to improve the care for future patients.
And I think the patient event unified them as a group so that when they went to the co-design event with staff members present, they felt that they were unified and that I felt that they felt strengthened by this.